Having a, there it is. Okay. Had a minor technical issue for a second. Okay, well, hello everybody. My name is Stacy Bright. I'm a QA and trainer with BioQuest Psychiatric and Behavioral Solutions, and welcome to Positive Behavior Support Training. Our objectives today will be to learn about behavior, how it works, and why behaviors occur. We'll discuss what our role is when we're dealing with behaviors. We'll learn some effective coping skills as well as techniques to aid in redirection to interrupt negative behaviors or to de-escalate a crisis. We'll know how to recognize and deal with dangerous behaviors that we could also potentially face from clients. Right, so let's break down exactly what it is. What is behavior? What are the characteristics of behavior? It is an action. It's what a person does that can be measured or counted. There's a beginning and there's an end. There's a reason for it. The behavior serves a purpose or it has meaning behind it. It's communicating something. So we're always trying to say something, but maybe we don't always have the right words. Behavior is how we know we're alive. It helps us to survive and enjoy our lives. It enables us to meet our own needs and helps us to communicate. So we need to ask ourselves, how does behavior work? What makes a behavior effective? Why do it at all? So all behavior serves a purpose. We use them to achieve a desired result. Some behaviors are more effective than others. Some are not effective at all. And then there are some behaviors that are more acceptable than others. But regardless of who you are, if a behavior gets results, it will be repeated to continue getting that result or to meet a need. Excuse me. This is true for everyone, not just those that we serve. So let's think about it. I've been asking staff to help me get a cup of coffee for a while now, but nobody has time. No one is paying attention to me or the fact that I have a need. I need help. What is something that is guaranteed to get my staff's attention? One thing that I know for certain, because it has always worked in the past, I might start banging my cup in my hand loudly on the table, and I'll bet somebody's going to pay attention to me now. And this I know for a fact. So people don't change behavior because someone else wants them to. They change it to make things work better for them, to achieve a different result. So why does behavior happen? What is the purpose? Well, there are a number of causes or reasons that a person may exhibit maladaptive behavior. Something is wanted or needed. They may try to engage you in conversation or try to get you to pay attention to them through positive actions like completing tasks or making jokes, just interacting with you. But if that doesn't work, they probably have learned that the quickest guaranteed way to get attention is to behave in less positive ways, like throwing things, yelling, or hitting. Because it will work. It may not be the attention that they were hoping for, but it is attention nonetheless. The person might be trying to escape from or to avoid something. If a person does not want to do something, they may whine, complain, or just flat out refuse to perform the task. The behavior could be for entertainment and sensory input. And this can be especially true for people with autism spectrum disorder. Behaviors such as humming, picking skin, hitting their heads, spinning, or flapping their hands can be soothing when they're stressed, and it can provide sensory stimulation when they're bored. A person might be trying to express intense feelings, such as happiness, fear, anger, sadness, and to release stress. The expressions can range from smiling and laughing to crying, screaming, throwing things, or hitting. There could be a biological, biochemical, or developmental processor issue. When people are hungry, they eat. If their head hurts, they may hold it in their hands or rub their temples. If hormones are in transition, a person may behave unpredictably or become more easily agitated. Medical and biological issues can include medication side effects, hunger, nausea, constipation, tiredness, illness, pain, allergies, or blood sugar levels could be off. And this can also include biochemical aspects of depression, bipolar, trauma, or psychosis. The behavior could be to communicate something. Your client's hungry and they're not able to get their own food. They'll use behavior to communicate that need. They may grab your hand or your arm and lead you to the kitchen, or they may point to indicate what they want exactly. And if those things aren't effective, they may ramp it up a little and act out in other ways, like maybe taking someone else's food. So, how does behavior work and what do clients get out of it? What are the rewards for the behavior? The reward will be having a need met or accomplishing a goal. And what about the consequences for a behavior? What is the end result? It's going to depend on a few things. Circumstances matter. Having some context about what is going on at the time, along with what purpose is being served by it and what need is being met. So let's look at a couple of examples. I want the dishes washed so I can make dinner, and it's not my turn to wash dishes. So, what are some possible behaviors that could help me accomplish that goal? I could refuse to cook anything until they're washed. I could yell, bang things, make a mess, or maybe I'll simply remind my roommate that it's her turn to do them. What are the rewards and consequences from each of those actions? Refusing to cook or yelling and becoming agitated is more than likely going to create a hostile environment and may cause some friction between myself and my roommate, and it's not likely to accomplish anything positive. However, by asking her, being polite, I'm showing respect towards her, and I'm more likely to achieve the desired result. Or maybe my favorite TV show's on tonight, and I am so excited to watch the latest episode. But when I get to the TV room, I find that my roommate is already watching something different. So now what to do? Now I'm really upset. I'm mad. I'm going to go to my room, turn my music up really loud, loud enough to drown out the TV. If I can't watch my program, then no one else is going to watch theirs either, right? Or maybe I'll yell and stomp around the house, just being intentionally loud and disruptive because I don't get to watch what I want. Well, those are a couple of options, but there was another choice. What if I express my need calmly and tell my roommate I had something special to watch tonight? What are the rewards and consequences from each of those behaviors? Turning up my music is loud and again disruptive, not to mention just rude. It's more than likely going to get me some negative attention, but will very doubtfully accomplish what it is I truly want. Becoming angry, yelling at others, showing signs of aggression. Again, I'll get attention, but not the positive attention that may get my need met. By talking about my needs, expressing what it is I want or could become upset about will be a more effective behavior. Showing respect, kindness, and a willingness to compromise gains that positive interaction or attention I need to help me accomplish my goals. How many times have we seen a client become upset or agitated for what we perceive as no reason at all? Once, maybe twice? We've all seen it happen at some point. But here's the thing, we were wrong. There is absolutely a reason for them acting out. It's just not obvious yet to you or I. But that doesn't make it any less real for your client. We cannot always know the specific reasons for a behavior for anyone until we get to know that person, and that takes time. What is important for us to remember is that all behavior serves a purpose. It's communication. It's a way for a client to tell you something or to have their needs met. Each of us is unique, meaning what is effective for one client may not have the same result for another. And it's the same with maladaptive behaviors. If two clients are acting out, what one client is expressing doesn't mean the other client has the same need. Each will have their own unique wants and needs. We need to understand the why, the reason behind the behavior. What purpose does it serve? What is it they're trying to communicate, or what need is being met by this behavior? What are some alternative behaviors that you can offer the individuals to help them replace the inappropriate one? Because the inappropriate behavior will not cease unless that need is still being met in another way. Environmental factors that may affect behavior. There are a variety of factors that may affect behavior. But when you notice there is clearly something bothering your client, but that something isn't obvious to you, it's time to play detective a little bit to determine what is distressing them. So let's start with the environment, the world around them. The lights might be too bright because fluorescent lighting is very bright and glaring. Well, we can soften lighting in a room with lamps or sheer covers that you can get to put over the panel lights in the ceiling. Or it could be too dark in the room, which in case we can add a small lamp or a nightlight. Maybe the day area is too loud, noisy between the staff and the other residents. There are so many people there. It's chaotic and hectic. You could offer to go with or assist your client to go to a quieter, calmer area until things settle down a little bit. Is the area around them cluttered, messy, or unorganized? That can be potentially triggering for someone with OCD. What's the weather like? Is it rainy, cloudy, and dreary? That can also affect someone's mood. Did the daily schedule get disrupted or changed at the last minute? This can be especially challenging for those individuals on the autism spectrum. The music or TV might be blasting too loud. There are smells of food cooking coming from the kitchen. The environment can often trigger behaviors due to the client's inability to control or change those factors. We can help them control their environment, though. Lighting and temperature, we can control. The TV or music can be turned down. If it's a smell, we can use a fan or find a centered air freshener. There's options. But what if the problem isn't environmental? Now what? Well, let's look at their recent interactions. Did the client maybe have an interaction with someone that may have upset them? You may not know how someone else's personal interactions occurred. Voice tone and the words we choose can absolutely impact someone else. And we've all experienced that at some point in our lives. Sarcasm is just being mean, especially if it's embarrassing or teasing to the client and they don't think it's funny. Or someone they thought was a friend is ignoring them now, or there could have been a confrontation that you're unaware of. We should absolutely talk to our client about it if this is what has caused them to become upset. Be reassuring to them. Be empathetic to their distress. You could offer some kind of distraction or offer to mediate between them and whoever they had the disagreement with. Role model how to mend fences or how to talk things out to find resolution. And then there are those patient specific triggers. Like we all know Tom gets very upset after each visit with his mom and dad because he can't go with them when they leave. What can we do to help? Well, while mom and dad are still there, we can start engaging Tom in a different preferred activity, something he likes. And hopefully that'll have his mind occupied elsewhere when the time comes for mom and dad to leave. Some people will act out if they feel sick or if they're struggling with their mental health. Trauma history can be a huge contributing factor. Not knowing someone's entire history, we won't necessarily know what may trigger them. Sights, sounds, smells, interactions, anything related to a traumatic event in their past can be a potential trigger. Them acting out or showing aggression could be a trauma response. So we want to think about those things that we can change or impact to lessen the negative behavior or even lessen the potential for it. So how can we help? Our role should be that of support for those positive behaviors and to help prevent the challenging ones. So, thinking from the perspective of a provider, what are some ways to get to know a person as well as get to know about them? Well, that's the starting point to be able to effectively practice positive behavior support. If you don't know anything about them, how do you know what kind of support they need? And if you think about it, the people we serve, they're not that different from you and I. When we feel heard, respected, we are much more willing to share, problem solve, and work together to find a solution. It doesn't matter if an individual can verbally communicate to you or not. They can still communicate and relay what it is they want or need. Just because someone can't talk doesn't mean they can't communicate. Doing our homework prior to meeting a client is a really good way to get to know about them. Read any previous documentation available to you. Depending on the facility, that may be the patient chart or a treatment plan. Read some recent progress notes and the most recent evaluations. Talk to those people who know them best, or at least know them better than you. Keeping in mind that if you do speak to anyone other than the client or guardian, there must be a release of information completed prior to that conversation. That could be a family member, a close friend, or maybe a preferred staff that they really trust. One of the most valuable techniques we can use is observation. By not just listening, but actually hearing what your client is saying. What about their facial expression and their body language? Body language? What's it telling you? What are their actions indicating? We must pay attention to the client as a whole, not just the words they say. So have you ever stopped to think about the lives your clients more live, more specifically, how limited and few their choices are? I'm sure most did not choose to live in a long-term care facility or to have poor health or to have a developmental disability. They already have so very few choices in their lives. So being mindful of that when working together can allow you to help them plan for success. As stated on the previous slide, listen to them. Use active listening to fully hear what they're saying. Listen with your eyes. See how their facial expressions and body language are reacting. Respect the person's feelings. Don't tell them they're wrong or that they're being silly. Often a person being supported relies on nonverbal cues of the person, nonverbal cues, and they can tell if you're being patronizing or if you're treating them like a child. You can provide an alternative activity like coloring, listening to music, talking to someone, going for a walk, Practice their deep breathing. Rely on your knowledge of the person's interests and preferences for what to direct them to. Know, respect, and implement their normal routine. And if they don't have one, help them develop one. A schedule or routine gives your client much needed structure. It's reassuring to know what to expect and what's coming up next. Assure that the person has as much choice and control as possible. Give choices at whenever an opportunity arises. There are so few things that some of your clients have control over. So imagine how that makes them feel. If it's an activity or appointment or something they may not be particularly excited about, give them choices of the where, when, how, or why, or any part of it that you can. Do they want to eat inside or outside today? Do they want to take a shower or a bath? Do you want to use the green towel or the yellow towel? Do you want shower gel or bath soap? So even when it seems like there's no room for choice, we can find some for them to have some sense of control over their life. We should avoid saying no to our clients. There are so many ways to say no without ever uttering the word. As soon as you say no to a client, you've taken away their choices or their ability to make a choice for themselves. On the other hand, clients can absolutely say no to us, and it's okay. They should never be made to feel any differently. We should be empowering our clients to feel safe and be able to express their wants and needs openly without any fear or hesitation. We need to practice what we preach and model the behavior and interactions that we want to see our clients exhibit. We teach client appropriate and effective skills and behaviors. So we should be responding to challenges in the day and circumstances in the best possible way. Demonstrate calm, control, problem solving, respect, and consideration for everyone, clients and coworkers alike. Show clients what to do through your own behavior. We cannot hold our clients to a higher standard than we ourselves meet. So, do you know what it looks like when your client is becoming stressed, anxious, angry, or fearful? Some clients will pace, others may tap their fingers or their feet, some may get louder vocally, others may give verbal cues. But knowing those symptoms and triggers is a vital step in preventing escalation. As soon as those signs are evident, offer that positive support immediately, whether offering a distraction to get their mind off of what they may be stressing about or prompting them to utilize coping skills to help them get through it. Immediate intervention can make all the difference in the outcome. Whenever possible, we can try to anticipate potential problems and figure out if there's a way to avoid them altogether. Knowing your clients and what could trigger them is an important factor here. For example, if you know that Sally is afraid of dogs and next week's picnic is planned at a local outdoor facility that is right next door to a dog park, you and Sally work together ahead of time to come up with a game plan for what she is going to do or not do to avoid the dog park and still enjoy the picnic with everyone else. It's a big facility with tons of room on the opposite side of the dog park next door. Sally's going to hang out over there and not have to look at or deal with any of the dogs that may be at their park. They have a great plan, right? But what happens when there's a problem that's unforeseen? That's something we didn't know about ahead of time. We get to the facility and find that they have some remodeling going on that was not mentioned on their website. The area farthest away from the neighboring dog park is closed during the construction, and that was supposed to have been Sally's safe space for the event. Okay, now we should have some sort of a backup plan for those just in case moments like this. Sally brought her noise canceling headphones and some of her fidgets. She feels that if she doesn't hear the dogs, she won't be so focused on them being close to her. We found a picnic table far enough away from the fence that separates the two places, and that's where Sally is going to hang out with her friends. That a girl, Sally. So when someone is doing it right, let them know. All of us respond better to positive reinforcement. Go out of your way if you must, but let your client know what they did good and encourage them to be proud of themselves. Tell them you're proud of them. Help to build that self-esteem. Our reactions can greatly influence behavioral problems. Let's talk about some steps that can be, let's talk about some steps that can be followed to help in redirecting your client. Using a calm, soothing voice, it's important that your body language matches your tone and your words. If your client is okay and you have permission, gentle touch is a very powerful tool in conveying a caring attitude. Use short, simple sentences. Keep things easy. If your client says something that you disagree with or that you know is not correct, so what? This is not the time to argue or correct them about any statements they may have made. Now is the time that we want to listen and validate that we understand what it is they're trying to say or communicate. Redirection is a way to distract your client from something that may be distressing to them. We're interrupting their focus and directing it towards something else. You want to be respectful of your client's feelings. Don't tell them they're wrong. Don't try to correct them. And don't diminish what they're sharing by telling them they're being silly or it doesn't matter. Often clients will rely on our nonverbal cues. Again, they will know if you're being patronizing. Don't insult them by doing so. You want to provide an alternative activity to be a distraction for your client. We want to shift their focus from what is upsetting to them, what is upsetting them, to something positive, something that they should enjoy. The behavior they were engaging in was meeting a need for them, and that's the whole purpose in doing it. If we want them to stop, we need to help them figure out something else that will fulfill that same need, but in a more appropriate manner. Basically, we need to find something to replace it with. There will be a time when a person will focus on the same issue repeatedly, or will have specific triggers that upset them. When there is a known circumstance that can cause your client to become upset, angry, or anxious, it should be addressed in their ISP. Following the guidance of their plan, it may be best to simply get their mind off of it, distract them, and redirect them to something else, another preferred activity. So let's look at an example of redirection. Mr. Jones is afraid of storms, and if he hears that it's going to rain that day, if it's in the forecast, he will sit and stare out that window watching for clouds all day. This causes him to become agitated, even if he doesn't see any clouds. So, what might be a method that we could redirect Mr. Jones? In a case like this, it may be addressed in his ISP since it is a known behavior. So staff would likely be aware of any inclement weather that may negatively impact Mr. Jones. Having that knowledge gives staff a chance to have Mr. Jones engaged in an alternate preferred activity and keep him distracted from the weather outside. But remember, it's important to validate how your client is feeling or what they experienced before you're attempting to redirect them. Let them know that you hear them and tell them as much. I hear what you're saying, and then repeat it back what you understand the issue, the problem to be. It's a good idea to make sure the activity that you're going to offer as a distraction is something that your client actually likes. It's something they enjoy. It doesn't necessarily have to be fun for you. It also needs to match your client's functioning ability. Use what you know about your client to choose what activity to use for redirection. Go for a walk, listen to music, attend an activity together, play a game. You want to teach positive, healthy coping skills and reinforce those skills that we eventually want to see our clients utilizing when they're experiencing symptoms. A couple of more examples of redirection. While we're out walking with our client, we notice a dog is being walked in our direction. Our client starts getting anxious and tells you that she is very afraid of dogs. Well, there are a couple of easy, reasonable options available. If it's safe to do so, you and your client can cross the street and just simply avoid the dog altogether. Maybe you can distract the client by bringing up a topic that you know will interest them and start a conversation. You can point out something else in the environment to draw their attention away from the dog. Or maybe your client wanted to watch a particular show on TV, but it's not on after all. And you might say something like, I know you must be disappointed, but if there isn't something else you might like to watch, maybe we can do something together instead, play a game or something. Offer alternatives, alternative choices or options, but it really is how you present things. So if you're offering options, but you appear stressed or uninterested or irritated about it, how do you think your client is going to respond? However, if you present an alternative and you're excited about it, you're happy and you're optimistic, well, guess who else is going to be happy, excited, and optimistic? Your client, because they do take their cues from us. We all know they look to us when we're modeling behavior at times, even without knowing that they are. When we want to learn anything new and be good at it, we practice at it. We help our clients learn new skills in the same way by practicing. Now we're going to watch a short video about what are coping skills.
Welcome to Mental Health Minute. What do you do when you're stressed or feeling a strong emotion? Do you yell, take a deep breath, eat a cupcake? Coping skills are tools and techniques you can use to help you manage strong emotions and decrease stress. You ever felt like things are out of control? Using a coping skill can help you gain control of your emotions in the moment. You can also use these tools to help you stay balanced and avoid distressing feelings. Let's talk more about cupcakes. Eating and enjoying a cupcake could be a healthy coping skill. However, eating a whole dozen cupcakes could be really unhealthy for you. Other healthy coping skills could be deep breathing, listening to music, or going for a run. Healthy strategies can also be built into our routine to help us maintain balance and manage everyday life stressors. Think about connecting with friends or family, exercising, maintaining good sleep, and eating habits. These things help us to be our best on a regular basis. Developing healthy coping skills is often a trial and error process. What works for someone else might not work for you. It's important that you try different things in order to figure out what works best for you. What will you try today?
All right, fight or flight. It's that mechanism in the subconscious that is triggered when the brain is starved of oxygen. That is also when anger can turn into aggression. So what do we do if we want a big dose of oxygen? We take a big deep breath. Deep breathing is a simple yet very effective tool to help one calm themselves. As stated previously, practice this technique when your client is in a good place, when they are more likely to retain and use it. If they are already past that point, then that is definitely not the time you want to practice. So let's practice one full round. Make sure you take in a full deep breath. And we're going to repeat it 3 times. Ready? Breathe in and out. In and out. One more, in and out. Next, we're going to look at star breathing. You'll want to model how to do this along with your client and practice with them. So how it works, you start at any breathe in side of the point of the star. Take a deep breath in, hold at the point, and then breathe out down the other side. And you'll repeat it around each point of the star. All right, so we'll start at the top. Practice this. So breathe in, hold, and breathe out. Breathe in, hold, and out. Breathe in, hold, breathe out. In, hold, out. Breathe in, hold, and out. Anchor word. Think of anchor word as a magic word or phrase used during breathing and relaxation exercises. While practicing those exercises with your client, you may say calm, letting go, breathe, or let's relax as they are doing the exercise. After some time of practicing using this magic word or phrase, it will begin to trigger the positive, safe, relaxed feelings that were developed during those practice exercises. The goal being that when your client finds themselves in a crisis situation, using their anchor word along with some gentle prompting will help them to quickly find their happy place. That word will be associated with being calm and relaxed. Progressive relaxation is another great tool. Why this one works as well as it does is because we cannot be both tense and relaxed at the same time. It's just not physically possible. Therefore, it has to work. This exercise can take as little or as much time as your client would want to spend on it. A couple of minutes or 10 minutes, whatever helps them and that they're comfortable with completing. So next, we have a short relaxation practice, progressive relaxation exercise.
Miss Erin Doctor presents Breathing technique number 3, progressive muscle relaxation. Hello, friends. This video will take you through a short version of progressive muscle relaxation. Lots of people find it useful to do when laying down to go to sleep. Are you ready to get started? Let's do it. You can start by laying on your back or sitting in a supportive chair. Uncross your hands and feet and lay your arms down by your sides, or rest your hands on top of your legs. Take a moment to notice your breath. Slowly start to breathe in a little longer and breathe out a little longer. Let the breath raise your belly when you breathe in and lower your belly when you breathe out. My friend PJ is going to show us what to do. As you breathe in, we are going to tighten different muscle groups. And as you breathe out, we will relax the muscles. Thanks, PJ. We will do each area 2 times. When you squeeze your muscles, you don't have to squeeze as tight as you can. Just make some good effort. Let's get started. Bring your attention to your feet. On your next breath in, squeeze all the muscles in your feet, curling up your toes. As you breathe out, let them relax and become heavy. On the next breath in, squeeze the muscles in your feet again. And as you breathe out, let them relax and notice that your feet feel warm and heavy and relaxed. Bring your attention to your legs. As you breathe in, tighten up all the muscles in your legs. As you breathe out, let your legs relax and become heavy. On your next breath in, tighten up all the muscles in your legs. As you breathe out, let your legs relax and notice that your legs feel warm, heavy, and relaxed. Now, let's bring your attention to your belly. As you breathe in, tighten all the muscles in your belly. As you breathe out, let the muscles relax. On your next breath in, tighten up all the muscles in your belly. And as you breathe out, feel your belly relax and notice that your belly feels warm, heavy, and relaxed. Next, bring your attention to your arms. As you breathe in, tighten up all the muscles in your arms. As you breathe out, let the muscles in your arms relax. On your next breath in, tighten up all the muscles in your arms. As you breathe out, feel your arms relax and notice that your arms feel warm, heavy, and relaxed. For the last one, bring your attention to your face. As you breathe in, scrunch up all the muscles in your face. This is as scrunched up as I could get her to look. As you breathe out, let the muscles relax. On your next breath in, scrunch up all the muscles in your face, almost like you're trying to pull your whole face into a circle around your mouth. As you breathe out, let your face relax and notice that your face feels warm and heavy and relaxed. So, how do you feel? Relaxed, I hope. Remember, you can watch this video anytime. You could use some help settling down. And until next time, take good care of yourself.
Guided imagery is another powerful but gentle tool that helps focus our imagination in positive ways. We aren't just picturing a beautiful beach paradise in our mind. It's so much more than that. We are smelling the salt water and the scent of the flowers in the air. We're hearing the rustle of the palm trees blowing in the ocean breeze. You're feeling the warm sand under your feet and between your toes, tasting the saltiness of the ocean on your lips. watching the waves gently rolling in the shore. We use all 5 senses to completely focus, and it can help ease stress, help one sleep better or lower their blood pressure, reduce anxiety, and to de-escalate when upset. Let your mind and senses take you to a safe place. On the next slide, we're going to practice some guided imagery together. All right, so this is just a short guided meditation. So make yourself as comfortable as possible. Close your eyes and imagine yourself in your favorite place. Notice the scenery. What colors do you see? What is around you? What shapes do you see? Picture your place as vividly as possible. Notice the sounds in your scene. Try to hear the air moving around you. What do you hear? And how are the sounds relaxing to you? What do you smell? Is it familiar or something new? And how does it help you feel comfortable and safe? What do you feel on your skin? What is the temperature? Can you feel the air moving on your skin? Notice all the sensations in your body as vividly as you picture your favorite place. Continue to keep this scene in your head. Allow yourself to fully experience this place. Take a deep breath and slowly let it out. Take another deep breath and allow your muscles to relax with each exhale. Now slowly count to 5. Perhaps you'll become more relaxed as you count. 1, allow yourself to become totally relaxed, more deeply relaxed with each count. 2, notice any stress or concerns being released with each breath you release, so that it almost feels as if you're exhaling any tension that might be present in your body and your mind. 3, you may or may not notice some outside sounds. And if you choose to pay attention to them, you might let them help you in becoming more and more at ease and relaxed. Or you may just choose to let them go. 4, more and more deeply relaxed. And 5, continue breathing and give yourself the opportunity to enjoy this comfortable place. There are some differences in progressive relaxation and guided imagery. Progressive relaxation is body-based. The participant will focus on specific parts of the body to tense and release muscles, and releasing tension along with it. Over time and practice, this exercise teaches the body to release tension. Guided imagery is using one's imagination to find a pleasing, calm setting or place. And then utilizing each of the senses, the person will visually see details in their scene. Then notice any smells that would be there, how it feels on their skin, tastes like, and sounds like. Using each of the senses to focus on that place in your mind, everything about it, and what is relaxing or calming about it. So think about what coping skills that you've used in the past to help your clients deal with stressful situations, and any ways that those skills may have seemed to help them. Excuse me. So how do we avoid power struggles? Let's go through the life cycle of a power struggle. All right, so step 1, the power struggle starts small. Betty approaches you not long after dinner and tells you she's hungry. Step 2, the staff responds in a disagreeable manner. You respond to Betty, "We just ate dinner, you can't be hungry." Step 3, the client responds with more assertiveness. Betty becomes very insistent and angry, raising her voice. She's got her hands on her hips, her eyes are narrowed, and she says, "Don't tell me how I feel, I'm hungry." Step 4, emotions flare in both parties now. Now you've become defensive and a little frustrated because as staff, surely, we know best, right? You tell Betty, again, "You can't be hungry. We just had a huge dinner." Now you're standing there with one hand on your hip, raising your voice, pointing at Betty. It's just escalating. Step 5, in desperation and without knowledge, the client becomes more aggressive and angry. Now Betty's mad. She has been dismissed, her feelings completely invalidated by the person who's supposed to be supporting her. And it all goes downhill from there. So what sets a power struggle in motion doesn't have to be a big event. It can be something as small as this. Most, not all, but most of the time, our response can dictate whether a situation escalates or not. It can actually be perceived as pretty arrogant to tell someone else how they should be feeling about anything, as if they can't determine that for themselves, what they need, feel, or want. Our role is support, not to be in control or not to be anyone's boss. So instead of telling Betty that she can't be hungry, what if we just asked a few questions to actually determine what, if anything, is going on? Maybe she's bored. Maybe she didn't eat much during the meal and she really is just still hungry. Whatever it is, though, we should be supporting Betty to figure it out and not just assume that we know and that we know best. The best way to deal with a power struggle is to avoid it altogether. But once that ship has sailed, you can use simple, effective, proven techniques that will allow you to deal with it successfully. You want to develop a good rapport. The key to any successful relationship is communication. Your client needs to know that they are supported and that their choices are respected. But you need to earn their trust and respect as well. Keep your emotions in check. Clients will take their cues from you. If you're excited, loud, and anxious about a situation, your client is going to be equally excited, loud, and anxious about the situation. So maintaining your composure, mind your facial expressions, your body language, your voice tone, and certainly your word choices as well. Identify the bait, like what set everything in motion, like got it all going. Listen, hear what your client is saying with their words, facial expressions, and body language. Prioritize the issues. Is the conflict over something that can be easily resolved, or do we need to compromise to accomplish something? Give your client real choices every opportunity you can. Your clients have so few choices in life. It's important to let them make their own decisions as much as and whenever possible. Strive for a win-win situation. Compromise, compromise. It's not about being right. It's about supporting the client to be right. Limit the audience. There are times when clients notice they're getting even more attention from an audience. It can certainly ramp things up when that happens. Avoid threats and promises. A client should never, ever feel that they're being punished or that they even could be. So there should never be any type of threats and no promises either. That's not a role that, and we are not able to guarantee anything. Say, I'm sorry. It can go a long way toward reaching out to your client during conflict. So when conflict occurs, doing something unexpected can be a great way to distract clients from what they may be focused on. So for example, you have a client who is starting to become agitated. He's pacing rapidly up and down the halls, rubbing his hands together. The staff very quickly, loudly, almost at a shout, said to him, "Tell me everything blue you see in the room, go." It startled him enough out of to whatever was on his mind that he would start looking for blue items. It was a simple example, but it was a good, effective, and quick. That was simple step also bought time for staff, gave them a chance to figure out what was going on and how they should proceed. Evaluate, prioritize, and stick to the basics, asking yourselves, what is the essential here? Is there another way we can do this? What's the routine, and will this help build the relationship? Does this have to be done now? Does this have to be done this way, or is there an alternative? In the moment, just keep to the essentials and don't worry about the rest. And when conflict occurs, that's not the time to try and problem solve or immediately fix the issue. A crisis is never going to be an ideal teaching moment. Work with your client to find a compromise, a solution where both of you are winning. You got to keep in mind, it's not about you. You can't take it personally. Remember, your role is to support and assist, not to dictate or enforce rules. Clients should never perceive that they are being punished by you or fear any sort of retribution from you or anyone else. Give your clients the ability to make their own choices and have control over themselves. This should be not only allowed but encouraged to arrive at their own acceptable solutions. So when we talk about dangerous behaviors, there are some things that you can do to prepare for a dangerous interaction. Have a plan before you need it. Practice it outside of your clients, of course, but know what you're going to do in the event it happens. When you should seek help? So when should we seek help? When we start seeing triggers or warnings that the individual is beginning to escalate, when you are scared for yourself or others, when you cannot provide safety for the client, yourself, or anyone else who may be there. When do we call 911 or request an intervention officer? When an individual's physical aggression can't be de-escalated per strategies listed in their plan, in their ISP, and is potentially dangerous to the individual and others. What are some things that you should be aware of? Did the client have a recent medication change? Has there been a recent change in the individual's life, whether staffing or roommate changes, housemate changes? Have there been any changes in their sleeping or eating patterns? Is there a current or possible medical or mental health issue going on? And what's considered dangerous per the client's plan, per their individual service plan? Explosive temper resulting in aggression, physical attacks, threats that have been played out and are dangerous, any destruction of property that can lead to self or others being injured. What do you do at the peak of the crisis? Know your individual's plan and use that for guidance. Send others away from the dangerous area. Stay calm and use a soft, steady voice. Call for help or 911 if necessary. Don't try to reason with or discipline an individual that has escalated. Stand at least one leg length away from the individual and stand in the L shape, which is non-confrontational and non-threatening. Remain in control. Stay calm and quiet. Disengage emotionally and don't take the behavior personally. You need to be flexible because at this time your client can't. You can use a pillow or a cushion to protect yourself if there is aggression, and take deep breaths to make sure that you remain calm. Know where to find help before the next crisis. You want to document immediately every detail that led up to the behavior and what happened afterwards. Schedule a time with the client's team to discuss, work together to put a plan in place that all members will implement, because this shows consistency and control. Know exactly who to call next time and what to expect from that call. You can seek guidance from any family member or team member that may know the individual best. Ask the individual what they need from you to feel safe if they're triggered. Establish a safe space with the individual that they can be guided to if they do begin to escalate in the future. Look at what worked, look at what didn't work during the time of the behavior, and then plan accordingly for the future. And know your own triggers so that we're not taking our own issues out on those that we serve. So what cues or signs does your client exhibit that can indicate to you that they might be getting upset, angry, or that a crisis may be imminent? Once that cue is noted or seen, what steps are taken to interrupt or redirect that behavior? So a client sticks his tongue out at staff or anyone who he might be looking at. To anyone who doesn't know him or his ISP, it may look like he's just being playful and silly. The reality of that simple act is a cue to his regular staff that he will almost certainly become physically aggressive and soon. This is our clue that he is frustrated because he's unable to get something or do something for himself. And the more time that passes without any assistance for him, the angrier he'll become. When sticking his tongue out was noticed by his staff sooner rather than later, they would ask what he wanted or needed, and the probable aggression didn't occur. That very easy redirection was usually very effective because his wants and needs were then being met. So just think about any signs or cues that your client may have that tell you there's a problem or that there is going to be a problem. And as soon as that cue is noticed or observed, ensure that steps are being taken to redirect. So let's discuss some ways we can help our clients during escalation. Allowing them their space when they're upset keeps the client as well as you safe. You're giving them some breathing room so they aren't feeling pressured or threatened in any way. Limit the audience by removing anyone not involved in the incident when at all possible. That could be other clients, staff, visitors. And you want to try to do so without drawing any attention or being overly obvious about it. While this is done for the safety of all, it also serves another purpose. There are times when a client will escalate because they believe they are getting everyone's attention or are the center of attention. And remember, negative attention is still attention. We want to subtly remove any potential dangerous objects Sharp items, heavy items that can be thrown or used as a weapon. Again, trying not to draw attention to the fact that you're doing so. Some verbal steps that we can take to help. And I know it's been repeated over and over, but that should tell us how vital it is. Maintaining a calm, quiet voice tone. We want to be soothing and comforting when we speak to a client who's escalated. Using as few words as you can, using short, simple sentences. This is not the time to be clinical. Keep it simple. Be at your client's level, both literally and figuratively. Giving statements of validation, of support, and offering clear direction, let your client know that you are there to support them, that you really are trying to help. And it's so important to be sincere, be kind, and be empathetic to them at that time. So what's next after the crisis? What do we do? What we do after is every bit as important as what we do prior and during. People need to feel heard. They need to feel that they're cared for before they're able to move on from a crisis. Offering statements of validation or empathy will allow them to feel understood. Statements like, I understand you're frustrated with your roommate, or I see that you're feeling sad, or I'm so sorry this happened to you. All of those statements show support and caring. We can offer statements of assistance, like, how can I help you with this? What can we do to make things better? Or what would help make you feel safer? These are statements that not only show that you care, but that you're concerned and you truly want to help. So we got to keep in mind, it's not about you. It's not about you being right or proving your point. It doesn't matter who's right or wrong. The only thing that matters is diffusing the situation quickly and safely for the benefit of everybody involved. It's about de-escalating the situation. That's it. No more, no less. Be mindful that we don't all share the same reality. And by that, I mean your client may be upset for what you perceive as something very minor, when in fact it is something very crucial to them. Don't dismiss what matters to them. Validate them and their feelings, regardless of how you may personally feel about it. And we should reflect upon ourselves to learn our own triggers. Is it a specific behavior or an individual? Maybe you suffer from PTSD, and when you hear the sound of someone yelling, it causes a trauma response for you. You cringe, try to make yourself smaller, folding your arms in front of you, keeping your eyes down. How do you respond to others in a crisis? And it's important to manage our own tone of voice, keeping an even tone, being aware of the nonverbal response that we give through body language and emotional responses. Like, think, where are you holding your arms in your hands? Are you keeping your hands open or a closed fist? Do you know when to say when? Dealing with challenging behaviors takes a toll on caregivers. It can be physically and emotionally exhausting. Knowing when to tag team with your coworkers to avoid becoming too emotionally involved or traumatize yourself, knowing when to say when is a strength. It is not a weakness. So what about you? Taking care of and supporting others starts with taking care of and supporting ourselves. Each of us should be doing all we can to stay healthy, not just physically, but emotionally, mentally, socially, and spiritually. Our entire self. Working out either by yourself or in the gym or with a group of friends. Keeping a standing mani-pedi appointment or a massage appointment. Reading a fabulous new book, cooking, crocheting, crafting, volunteering. Keeping those regular doctor appointments to maintain your health. Make time for it. Make time for all of it. If it helps you, if it helps make you feel better about yourself or your situation, whatever the case, and if it works for you, then that's effective self-care. What happens when we are in a good place, an all over good place? Like you're healthy and you're happy. Your family life is great. Professionally, you're killing it. Everything's good. You've taken the time to think about and name your personal triggers. Now you have a plan on how you will cope with triggering behavior that you may encounter during your shift, allowing you to wholly focus on your client's needs and not transfer your own stuff onto them. So what kind of a caregiver doing all of that, does that make you? That makes you a great one. Because putting the time and work into oneself is better not only for you, but for your clients, your coworkers, your family, your friends, everyone whose life you may touch. Knowing your own triggers and knowing those behaviors from an individual that could affect you is most crucial. That allows you to work through your triggers, again, so as not to transfer your own issues onto those you serve. Have your own effective coping skills to help you manage when or if you're triggered during your shift. Another phrase that we're all pretty familiar with is pick your battles. There are enough challenges to be faced every day for you as well as clients. So it's okay or beneficial even to be able to just let the little things go sometimes. Right, information in this section comes from excerpts from the Manual Principles of Caregiving, the Arizona Direct Care Curriculum Project. Well, I hope you all right. Well, I hope everybody is able to take the information given today and apply it to their facility and to their clients. Thank you very much for joining us.